Good afternoon, everybody. I will start with the prayer. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmain Sri Gurave Namaha, Tasmain Sri Gurave Namaha. With due respect to Swami Galananji, organizers of this summit, the respected coordinator madam, my co-speakers, Dr. Ganesh Rao and the guest speaker from Japan, and all esteemed delegates of this summit. I would like to speak the interdisciplinary approach. Thanks to Dr. Ganesh Rao, who has covered most of my points. He has not kept anything for me. So I have to pinch him in between. Please do something for me. But my angle is a little different.
This is the advantage of speaking first.
I knew that I had chosen it. I said I am going to present it because I was having 8 minutes presentation. So,
and sir, I have written 10 questions to ask, but he has answered all the questions.
But anyway, he has dealt with the philosophy and background of the yoga as therapy. But I being a surgeon, I have practiced surgery from 1974 to 2020, nearly 47 years I have practiced, and I have done not less than 20,000 surgeries, major to minor, in my surgical career. So I know, and I am treating patients with yoga therapy for the last 28 years. So I know what are the pitfalls and what are the actual practical difficulties for a yoga therapist. So that I am going to tell. So some points may be repeated, but that will be from the point of view of therapy for the therapist who is going to treat the patient with therapy. So I am glad to tell you that I am working in Kavaladham Yoga Institute as an assistant director of scientific research department, which has been established in 1924. So we are celebrating the centenary year this year. And I invite all those who have not visited the Kavaladham, you are most welcome to Kavaladham. Now, yoga is a 5,000-year-old science. It's an ancient Indian heritage, today's need, and going to be tomorrow's culture. Yoga can be practiced by anybody. It's not that you should go to the mountainous area after retirement and then practice. You can practice. The yogi science says, Yuva vruddhoti vruddhova, vyaditu durbalo piva, abhyasat siddhi mahapnoti, sarva yogeshva tandrita. Means anybody can practice any age, whether he is ill, sick or very healthy, he can also practice the yoga. As Dr. Ganesh Rao said, yoga has got a holistic approach. I will add few words into that, which he has not added. Because I have got authority because I am a surgeon. I am a person from the modern medicine, allopathy. So we have forgotten the holistic approach. In the 21st century, what we have done as an allopathic person, we have divided the human being in multiple pieces. And each piece is treated by a separate specialist without knowing what is happening with the other piece. And that is why the problems are occurring. Now, 21st century is called century of tension. And tension gives mental tension, which gives diseases like diabetes, hypertension, myocardial infarction, obesity, constipation, asthma. All these diseases, they are not caused by any bacteria, virus. They are caused by mental tension. And that is why it is said, behind every disease there is a cause, and no drug can reach that cause, and that is mind. Is there any treatment for mental stress in allopathy? Answer is no. But with yoga you can treat, and that is why the importance of yoga in the current era. Now, before going to the therapy part, a therapist, what he should know basic things. So that I am going to deal with it. He should know what are the types of diseases. The first is acute condition, second is a chronic condition, and third is acute and chronic condition. You should be able to categorize the patient, whether he is in acute condition, whether he is in chronic condition, so that you can definitely plan the yogic design for him. Because most important aspect is that in acute or serious condition, no pathy works except allopathy, not yoga also. So don't think of that. Let it go to the medical. Once the acuteness is over or it becomes chronic, when patient is advised to carry out his daily routine, that time you can advise him yoga practices, then you will get better results. But if acute condition you try to do yoga practices, you may fail. Now, currently medical expenditure has gone up from few hundred rupees to few 100,000 rupees, which a common man cannot afford. In view of modern science, has not got cure in all diseases. Though our allopathy has advanced so much, they have done research and everything, but still we are not able to treat the patient completely or give a complete cure to so many diseases. And that is why the search is on all over the world to find out alternative to modern expensive treatment, and that is yoga. You go to any country, you will find there are yoga studios, yoga clinics, and all that they are practicing yoga. Yoga can keep us healthy, also can cure the diseases. But Swami Vivekananda has said that every therapy has its own limitations, so too is the case of yoga as therapy. There are some limitations, and not all patients can be treated with yoga, so that you must remember. I would like to say proudly that Swami Vivekananda was a great visionary who was knowing that in future yoga will be used as a therapy. Hence he started first yoga college and first yoga hospital in 1961. Where traditional yoga is taught without dilution, patients are treated with traditional yoga to achieve good health results. And Swamiji was the first to give scientific basis to yoga, so that yoga will be acceptable to all and will achieve a reputable position in the modern world. We at Kevalgam are continuing to work to take his great vision and legacy ahead. Honorable Prime Minister has taken yoga globally. Now it's our duty to make yoga of high repute in society. Now for that, what we have to do? As a therapist, we must remember, must avoid making tall claims that anything and everything under the sun can be cured by yoga. One must learn and imbibe traditional yoga from authentic sources. One must understand scientific basis of yoga and follow the traditional yoga given in text and should not modify or use it in over-enthusiasm in unindicated diseases. I have seen people doing courses of yoga for 15 days, 1 month and putting the board of yoga therapists, and any patient comes, yes, sit here, I will clear you. It is not possible. But this is happening because yoga has become a very hot sellable item. And now it is our responsibility to see that such thing does not happen. Otherwise, what will happen? Again yoga will be blamed and it will go into the dustbin after 50 years. So that we have to avoid. To make it more acceptable to the modern world, we must know indications, contraindications and limitations of yogic practices in each disease. Better results are achieved with yoga as adjunct if used as per the guidelines. Now as Dr. Ganesh Rao has said, yoga can be used as a preventive, curative, adjunct and palliative. So you have to select the patient, you have to see whether he is which category and then do the yoga practices accordingly. Now preventive, as he said, that it is, if you practice yoga, you can keep yourself healthy. So it sets the biological clock of your body in such a way that it will not go wrong. And if something happens, you can add some more kriya. It's 5,000-year-old science. It is time tested. It is not necessary that we should again measure it on Western parameters. But to make the people aware and acceptable, we are doing that. Now, the sages were doing this sadhana, practicing yoga to keep themselves healthy, so that there is no disturbance in their sadhana because they are wanting to go to moksha. But the current person of 21st century, he is not interested in moksha. He is interested in only using the modern amenities of 21st century. So for that he wants to be healthy. Now what happens in any one office? Suppose somebody asks, "Are you have not taken casual leave on leave? Now this is the year end coming. Your all leaves are balanced only. Why are you not taking leave? You are not falling sick anytime?" He said, "No, I never fall sick." How can it be? तो फिर हिंदी में जैसा बोलते हैं, किस चक्की का आटा खाते हो? तो बोलता है, मैं जो आप खाते हो वही मैं खाता हूँ। फिर क्या करते हो आप? I practice yoga. Oh, you practice yoga. That is why you are healthy. Okay. So I will also practice yoga because I want to remain healthy to utilize the modern facilities. So that is why he is practicing yoga. Otherwise, he has got no interest in practicing yoga. Now, curative, useful in early stages of chronic diseases, mostly non-communicable diseases, early diagnosed diabetes, blood pressure. These patients, if they come in yogic practices, you can definitely revert and come back to normal. Now, adjunct therapy is a long-standing chronic diseases like non-communicable diseases which requires lifelong treatment. Total cure is not possible. In that case, we practice yoga as an adjunct therapy and it will prevent the progress of disease. It will prevent progress of disease, can keep disease under control, may not develop complications, and may make the life comfortable. Yoga as palliative. Yoga practices work at physical and mental levels. Dr. Ganesh Rao has given very detailed, elaborate view about that. So I am not going into detail. But it works at physical and mental level, and it is necessary for the treatment of the patient. So patient, we can divide into two patients having little better life expectancy, like all these diseases, and the patients in terminal stages. So there we can accordingly design the yoga. Palliative treatment may be difficult to implement in terminally ill patient. When he is terminally ill, if you go and tell him, you do the Sukshma Vyayam, you do little Kapalbhati, abhi kya marne ka, abhi kya bata rahe tum, and he won't do it. But if you start introduce yoga right from beginning, then he knows the effect of yoga and he will definitely practice it. So palliative care should start from diagnosis of the disease. Major diseases like heart attack, cancer, the day they are diagnosed, it's a big jolt to the patient. So that time they need the physical and mental support. So they have to be mentally fit to face the problems, and if you start yoga practice at that time, so it can be divided into three: immediately after diagnosis of disease, during active treatment, and after main treatment is over. Patient can practice yoga under yoga experts' guidance. I keep on telling this, hammering it, that never practice by watching the TV, by reading the book, or seeing somebody is practicing yoga, so he is doing, so I will also do like him. It is not possible because you won't practice it. Patient should not stop the medicines advised to him by a doctor. This is a basic principle, because by just joining the yoga class, a diabetic patient, his sugar will not come back to normal. He has to practice yoga. At least 1 month he practice, that will take care of his body, and then his sugar may come down, and that time his doctor will reduce the dose. You don't reduce it. And the yoga and medicine may prove to be mutually complementary. In cancer patient, I have taken this slide particularly because we don't know the cause of the cancer, so we cannot treat it purely, completely. Allopathy, we don't cure the patient of cancer. So no false assurances should be given. He should be given a moral boost. And second thing, as we don't know which stage patient is, whether he has got secondary metastasis all over body. So we don't know. So that's why we should not give more stress on performing asana, because he may develop fracture. Now modern medicine has advanced. So much research has been done, so many new medicines have come. So advanced modern allopathic medicine has added initially in the past 50 years ago, the life expectancy was about 50-60 years. Now it has gone to 80 years. So it has added days to the life, but no life to those days. If you see the non-communicable disease patient, they are taking tablet 2 in the morning for getting for diabetes, then for blood pressure, then afternoon before lunch they take 2 tablets for getting the hunger, then after lunch they take 2 tablets for the digestion, then again night to 12 p. So they are taking 10-20 tablets a day. So the life has become very miserable, and they have to face the complications of all these diseases. So let us add life. See, the word I have made little different. Life in capital and life in small. Life to these miserable days and make them comfortable with the help of yoga practices. Yoga improves immunity at local and systemic in general. At cellular level, health improves the balance between the pro-inflammatory cytokines and anti-inflammatory cytokines, downgrade and inhibit the expression of several pro-inflammatory cytokines. Psychoneuroimmunology helps in enhancing and inflammatory responses. Aim of any treating modality, whether it is Ayurveda, homeopathy, Unani, allopathy, should be to treat and cure the patient. That is the aim of any doctor. The diseased human being is miserable, frustrated due to setback at physical, mental and financial level. Each treating modality has got drawbacks, limitations, so that everybody should understand. And it will be good to keep individual egos aside and treat the needy person to achieve good results. If yoga is used as adjunct to any other treating modality, it will help to achieve total health described by WHO, which is at the level of physical, mental, social and spiritual health. So this is a good vision for healthy society and nation. So if you practice yoga along with any other, suppose if you practice as a preventive, no question. If you have got some disease, you can practice it as curative or adjunct or palliative. And I am thankful for giving me opportunity to share my thoughts regarding therapy, because I have been in practice seeing patients in and out for last 37 years. and what problem they face, that also I know. So I try to explain from my point of view, from practical point of view. Thank you very much for giving me opportunity to share.
Thank you so much. One thing I would like to ask is that with your experience that like how a yoga therapist can design his plan or the program for the patient. Like what should be the component of that?
Hello. So first thing, the yoga therapist should know that what are the scientific basis of yoga, what are the anatomical, physiological changes occurring while practicing different yogic kriyas. Then he should know which are the yogic kriyas that are contraindicated. Now suppose you take an example, Kapalbhati, traditional Kapalbhati with the forceful exhalation, where the part of the abdomen below the umbilicus is forcibly taken inside. Now if you take that part inside, it presses the intestine. If the intestines are pressed, they are pushed up. Above is the diaphragm, which is pushed up. Above the diaphragm is the heart. So there are chances that he may get problem if he practice the traditional Kapalbhati with forceful exhalation, or if he practices Agnisar. So that if the therapist knows that which are the yogic practices which cannot be given, or he knows the indications, contraindications of different kriyas in each disease, then he can design. Suppose a patient comes. Now any patient comes, he may not be only of single disease, only diabetes, only hypertension, he might be having diabetes, he might be having obesity, he might be having blood pressure also, or he might have heart attack and stent has been put. So you have to design it accordingly. So if suppose he has got high blood pressure, heart attack, then you have to omit the Agnisar, you have to omit the traditional Kapalbhati, you have to do simple Kapalbhati. Like that you have to design it. And second thing, whenever healthy person if he is practicing yoga, there is no problem because he is healthy. Still, I always advise that it should be under the guidance of the expert yoga teacher. And when he is practicing under yoga teacher will observe whether there is any problem when he is practicing. Suppose you do Bhujangasana, and after Bhujangasana he is comfortable, but you ask him to see the ceiling and oh, I am getting.
Yes.
You have to ask him. So in one word I can tell, balapurvak karega to balahani hogi. If you do any yogic practices with force, you will get bad effect. So you have to do it according to the text, according to the methodology, and practice it under the supervision of the expert yoga teacher. You will get definitely good results. And yoga teacher, if he is aware of all these facts and the clinical picture of the patient, he can design the yoga practices accordingly. And then you can definitely get good results. I have treated about 1800 patients of myocardial infarction with the help of yogic practices, and I have got the angiographic picture with me before and after doing yoga practices, and their blockages are gone. But meticulously I have to select the patient. There are so many criteria how to select a patient of heart attack who can be given yoga practices. Thank you.
Thank you so much, sir. Thank you.
Honoring Dr. Satish Pathak,